Hello and welcome. Today, we're diving into a common condition affecting women's reproductive health, cervical ectropion. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So, what causes cervical ectropion? The exact cause isn't fully understood, but several factors are believed to play a role. Hormonal changes are a big one. This means that conditions like puberty, pregnancy, and even taking oral contraceptives can increase your risk. The increased estrogen levels during these times can influence the development of the cervical cells. Some research also suggests that cervical inflammation or irritation might contribute to the condition. Let's understand the underlying mechanism. Normally, the inner surface of the cervix, the endocervix, is lined with glandular cells called columnar epithelium. This tissue is delicate. Cervical ectropion occurs when these columnar cells spread to the outer surface of the cervix, the ectocervix, which is normally covered by squamous epithelium. Squamous epithelium is tougher and more resilient. This displacement of columnar cells exposes them to the acidic environment of the vagina. Since columnar cells are more delicate, they become inflamed and easily irritated, leading to the symptoms associated with the condition. Cervical ectropion is quite common, especially in women of reproductive age. It's frequently observed in adolescents, pregnant women, and those using hormonal contraception. The prevalence is difficult to pin down exactly, as many women with cervical ectropion don't experience any symptoms and therefore never get diagnosed. Studies estimate it affects a significant percentage of women during their childbearing years. Many women with cervical ectropion don't experience any symptoms at all. However, when symptoms do appear, the most common one is abnormal vaginal bleeding, particularly after intercourse. Increased vaginal discharge is also frequently reported. Some women might experience mild pelvic pain or discomfort. It's important to remember that these symptoms can also be associated with other conditions, so it's crucial to consult a doctor for a proper diagnosis. Diagnosis usually starts with a pelvic exam during a routine checkup. During this exam, the doctor can visually inspect the cervix. If they suspect cervical ectropion, they might perform a pap smear to rule out any abnormal cervical cells. A colposcopy, a procedure where a magnifying instrument is used to examine the cervix in more detail, may also be recommended, especially if the pap smear results are abnormal. During a colposcopy, a biopsy, or small tissue sample may be taken for further examination under a microscope. Cervical ectropion isn't typically classified into types. It's more a description of the cellular displacement rather than distinct subtypes. Often, cervical ectropion doesn't require treatment, especially if the woman isn't experiencing any bothersome symptoms. In cases where symptoms are present and impacting quality of life, several treatment options exist. These include cryotherapy, which freezes and destroys the affected cells, electrocautery, which uses heat to remove the abnormal tissue, and silver nitrate application, which chemically cauterizes the area. The choice of treatment depends on the severity of the condition and the individual's medical history. It's crucial to discuss the best option with your doctor. There isn't a specific way to prevent cervical ectropion. However, minimizing potential cervical irritation can be helpful. Practicing safe sex to prevent sexually transmitted infections, or STs, and avoiding douching, which can disrupt the natural vaginal flora, are generally good practices for maintaining reproductive health. Regular check-ups with your gynecologist are also key for early detection and management. The prognosis for cervical ectropion is generally excellent. In many cases, it resolves on its own without any intervention. Even when treatment is necessary, it's usually very effective. While cervical ectropion itself isn't cancerous, it's important to continue with regular cervical cancer screenings, as recommended by your doctor. Recent research explores the link between chronic inflammation and cervical health, potentially leading to more targeted therapies in the future. Thanks for watching, and remember to consult with your healthcare provider for any concerns regarding your reproductive health.